Hey, it's Dr. Nuesse from Easy DOT Physicals, back again with another video. And in this one, we're talking about synthetic urine, fake pee, and can it be used to beat a drug test? Now, some of this is going to be my opinion based on my experience. I do run a drug testing sample collection site. And then we're also going to look at the research on drug testing and synthetic urine. All right, first, the obligatory legal disclaimer. I'm certainly not advocating that anybody try to cheat during the drug test. There are many different ways to catch cheaters during the drug testing process, some of which I will talk about today. So my official advice is make sure that you're clean and follow all state and federal regulations regarding drug testing. Is that clear? I'm not advocating cheating. And this is an informational video only based on my experience and the research that I will quote. Okay, does that cover everything in this CYA letter from my attorney? This is an informational video only. Tell people they should not cheat. Yep, I think I got it. All right, and with that being said, this channel is all about drug testing, pre-employment medicals, and compliance. So if you're in a job that requires testing, I highly recommend staying subscribed to this channel because when the government makes updates to policies or procedures, I make update videos. Stay subscribed so you stay informed. And if you are at all concerned about drug testing, the best way to know if you are going to pass a drug test is to home test. I will leave a link to my preferred home test in the description box below. All right, so when it comes to urine testing for drugs, let's talk first about the major issue in maintaining integrity during the urinalysis process. And the major issue is that the collector is not taking the sample directly from the donor. So what typically happens during a urine collection is that the donor will be in a room isolated by themselves, potentially for several minutes, a bathroom, and then they will collect and package the sample and then hand it to the provider. So I've done a full video on the collection process if you want to know exactly how this works, but that is what is typical. The donor actually packages their own sample and then hands it to the provider. So because of this, the door is opened up for the donor to either alter their sample somehow or switch it with a clean sample or switch it with a synthetic sample. So let's be honest, as uncomfortable as it might be to think about, if the collector was taking the sample directly from the donor, number one, I would find a new career. But number two is we wouldn't even be having a discussion about switching it with synthetic urine or altering it in any way. There would be no way or no opportunity to do that. And that's one of the main reasons for the alternatives to urinalysis: hair testing, saliva testing, some of which I will talk about a little bit later in this video. All right, so the question for this video is, can synthetic urine be used to beat a drug test? So to start to answer this question, let's first look at a research article from 2019. All right, so here is the study: can synthetic urine replace authentic urine to, quote, beat workplace drug testing? And we will go down and read the entire abstract because I think there are a couple different important points. So the abstract: synthetic urine, abbreviated SU in scientific studies, they love to abbreviate everything, which is primarily utilized by drug testing laboratories as a matrix for quality control preparation. So it's intended to be used by the lab to bolster their quality control, is now commercially sold and can be used to, quote, fool a positive drug test. To determine if SU, synthetic urine, can pass as authentic urine, we challenged Army urine drug testing specimen assessing and testing procedures using 8 different commercial SU products. Adulteration and on-site SU test strips were also evaluated. These are products that can be used to try to catch the synthetic urine. So 5 of the 8 synthetic urine were identified by physical observation. So basically what this means is if someone was actually observing someone else give the sample, which is not all that common, then 5 out of the 8 were actually caught trying to switch the sample. But all of the synthetic urine products screened negative for drugs. They all screen negative in the drug immunoassay and additionally passed the specimen validity testing. So they passed as valid specimens, as authentic urine. Furthermore, synthetic urine was not detected as adulterated with the adulteration test strips. So again, it passed that test as well, but it was detected as synthetic urine with the on-site synthetic urine method. So their advice is to deter synthetic urine use. Direct observation as utilized by the military may be recommended during the collection process. So that last statement there sure seems to indicate that the government is concerned about synthetic urine beating a drug test. All right, so that's a little bit about how the laboratories try to catch people cheating by switching their sample with a synthetic sample and the vulnerabilities that they have doing that. But what about when you go in to give your sample? What tools does the collector have at their disposal to try to catch someone cheating by switching their sample with a synthetic one? All right, so first, let's talk about some of the misconceptions. So misconception number one is that you're going to be patted down before going in to give your sample. Some people think that there's going to be some kind of like police pat down where we're checking your body very closely for contraband. That is simply not going to happen. And also, it is not typical for us to observe you when you are giving your sample. The FMCSA doesn't require this. Safety-sensitive employees are not required to have observed studies. Now, they certainly can. You certainly might go in and have an observed test done, but most of the time, you're going to give the sample in an enclosed room, a bathroom, by yourself, and then package it yourself, and then give it to the collector. And to be honest, even if we are observing you giving your sample, that is not a foolproof way to catch someone cheating either. There are many companies that make very convincing prosthetic devices. I made a video very recently on the most popular company that makes the Whizzinator. The people that manufacture the Whizzinator actually got sued by the federal government for trying to defraud their system. So that's obviously not a foolproof method either. All right, so what are we going to do to try to either keep people from cheating or catch them cheating during the drug testing process? So number one is we're not going to allow you to bring a whole bunch of excessive items with you into the area, into the bathroom while you give your sample. We're not going to let you bring in things like eye drops or chapstick or a contact case. So these things can be used to, unfortunately, alter the sample that you're giving. Now, this certainly doesn't apply to synthetic urine. Synthetic urine typically is kept very close to your body because the temperature matters as well. So along that line, we're also going to look at the temperature. The collection cup will have a temperature strip on it, and it needs to be within the temperature range in order for us to know that it is a real sample. And we're also going to be then looking at the color, maybe observing the odor as well. Synthetic urine does a very, very good job of mimicking both of those. So my opinion here is that you have a very, very high likelihood of actually getting synthetic urine past the collector and actually getting it to the lab. But what happens once it gets to the lab? So based on my experience, everything that I've read, the study that we looked at a little earlier in this video, laboratories are not doing a good enough job scrutinizing samples to be real. I mean, let's look back at the study again. The synthetic urine passed every single quality control method that was thrown at it except for one. Now, there's absolutely no way for me to give 100% certainty that a synthetic sample would get past the laboratory testing. It depends on the product that you're using. There's certainly different quality of synthetic urine products. It depends on the testing methods, obviously, etc. And labs are continuously updating their testing procedures. And because we live in a free market, certainly manufacturers of synthetic urine are continuing to up their game and make better and better and more convincing products as well. So my official opinion is that a good synthetic urine product kept at the right temperature has a very, very high likelihood of passing as a real sample and then testing negative during the drug testing process. And this is one of the main reasons for the alternatives to urinalysis in drug testing. Things like hair testing, saliva testing, blood testing, where the collector takes the sample directly from the donor. And in these situations, there's virtually no way to cheat. So right now, there is a major push for saliva drug testing, especially when it comes to marijuana testing. I've done a very short video on this, but just to recap, the real issue people have with urinalysis drug testing with marijuana is it can give you a very large window, up to a month or maybe even more. And with saliva testing, it's only a few days. So there's a big push for not only the integrity of the test, but also the testing window when drugs are detectable, for marijuana testing to be switched to saliva testing. All right, that's everything I know about synthetic urine and can it beat a drug test. I hope that this opinion video was helpful. And until next time, everybody, stay safe.